Good afternoon. It's another great day in the land of the living, right? But you know what? I tell you, the devil is, I can't even get this off this hat. I'll knock the hat off. The devil is really busy, though. And, you know, I've heard already this morning a lot of my mother. Got to get to my mother. Angela from Marcus Evans' office, got to get to her mother, Tanya's mother. You know? So I just want to, you know what? This is just on my heart. I just want to sing this little quick verse. Step back, relax your mind. Don't worry how he's going to do it this time. The time is coming where you're scream and shout. So take a deep breath, he's going to work it all out. I know it's hard for you to sit there. You think you've got it sorted out, you're prepared. My advice to you is that you leave it all there. Just admit there's no one else you know could compare. So take one look at me. I bet you'd never believe that the devil, he almost had me. I thought I'd never be free. But Jesus, he put his foot down. That's how he gets down on my enemies. However can I pay him back? Tell me, except to believe that he's a miracle worker and he's working for you and he won't stop working till your problem is over, 'cause he's a miracle worker. He's a miracle worker. He's a miracle worker and he's working for you and he won't stop working till your problem is over, 'cause he's a miracle worker. He's a miracle worker. And I have to, you know what, as a songwriter, I have to write songs for myself. Do you hear me? This one right there, I have heard it in my head so much. It's just, and I got it out. You know, as an artist, you want to get the thing out. So it's recorded. I'm getting it. It's on the radio. It's getting played. But I have to turn it on myself to encourage myself. So thank you all for coming out today. Dr. Lee, we got Alfred. I just feel some way for Tonya. She did an amazing interview yesterday on Channel 7. Did anybody see it? And then she had to go home and deal with that, right? But he's a miracle worker. And he won't stop working till her problem is over. He's a miracle worker. And so she put this all together for us to enjoy here today and get informed, because people are dying from cervical cancer. It doesn't make any sense. It's almost eradicated in some places, right, Dr. Lee? And here we are looking at it's going up because we're not informed. So that's why we're here today. I want to invite you, just keeping Sonia in prayer. We're about to pray, but keeping her in prayer because she needs some prayer on top of the prayer, right? She needs a little extra prayer, and her mom too. But I want to introduce a praying warrior for real prayer. Dr. Look at God. He'll be the showed you up. She is the Trinity United Church of Christ. That's where she attends church. Dr. Stacy Edwards Dunn, where are you? Come on up here. You know what? The devil. Okay. She's the executive pastor. She's an author of Hold On to Hope. You got your book? Didn't bring your book. Stories of Black women's fertility, faith, and fight to become mommies. And for color girls, the non-for-profit. Fertility for color girls. And she's here today with these beautiful kids. She's going to pray for us. Amen.
Well, good afternoon. It's on behalf of our senior pastor, the Reverend Dr. Otis Moss III, and the Trinity United Church of Christ, along with our affiliate, the Imani Village and Andaleo. We say welcome today to this facility, and also as we seek to take time to learn more about cervical cancer and its impact in our community, in the world, and particularly amongst black women, as we know that black women experience cervical cancer at higher rates than our Caucasian sisters. And this is a very important issue in our community that we must continue to have conversation about, as it does impact our reproductive health and our fertility as black women. Amen. Amen. And so it has been my charge to pray for us and pray for this program as we prepare to move throughout the day. I should say to you, as she stated, I do run an organization called Fertility for Colored Girls. It's the national organization for black women and couples who struggle with infertility and experience fertility challenges. And this becomes one of the challenges that women deal with in seeking to become parents as well. So this issue is also very near and dear to my heart on today as well. And we are also grateful for the contributions of our great ancestor, Henrietta Lacks, and all that she has contributed to medical research as well. Let us pray. Most gracious God, we come before you today with grateful hearts, honoring the life and the legacy of Henrietta Lacks, and we thank you for the gift of her cells, which have contributed so much to the advancement of science and medicine, saving countless lives and bringing hope to many. As we gather today to raise awareness about cervical cancer, we lift up all those today who have been affected by this disease, especially the women in our communities who face the challenges of diagnosis, treatment, and survival. We ask today for your healing touch on those currently battling cancer, and we pray for strength, comfort, and hope for their families. Lord, we also pray for the doctors and the researchers and the healthcare workers who dedicate their lives to finding cures and improving care for those with cervical cancer. May their work be guided with your wisdom, and may their effort continue to make a difference in the lives of those affected. We pray for a future where every woman, regardless of race or background, has access to care and resources they need to prevent, detect, and treat cervical cancer. Help us to work together to break down barriers and provide education, support, and care to those who need it most. In the spirit of Henrietta Lacks, who unknowingly gave so much for the benefit of others, we ask, oh God, that you would bless this program today and all who are working to raise awareness, promote healing in honor of those who have been lost to this disease. May your love and peace surround us all, and may we continue to strive for justice, compassion, and healing in every aspect of our lives. It's in your holy name we pray. Let all those who love the Lord say amen. Amen.
Good afternoon, everyone. Happy Saturday. My name is Candice Milan. I am the Vice President of the Henrietta Lacks House, also known as Gila House. Thank you to our Gila House team member, Dr. Tonya Roberson, who Dana mentioned. Unfortunately, she cannot be here today. Please keep her and her mother lifted in prayer. But I do want to thank her for spearheading and making this event happen. And I'm so appreciative to all of you for coming out today. We love teaching and sharing resources and information, and we love when people such as yourself come out to receive the information. We love community. I'm going to briefly tell you about Gila House. So our mission is to help you understand your own health care and your body. Your health matters the most, but the medical system and medical data is complicated and hard to access and hard to understand. And many share my same frustration with the medical system, which needs reform for greater ease, transparency, and inclusivity. So we aim to address these issues while acknowledging that it won't be an easy or a quick process. But we have to start somewhere, right? And that is what we are doing. We also strive to advance ethical medical research and address health disparities that exist in Black and brown communities. We have a wonderful team leading this initiative. we have Alfred Lacks Carter Jr. sitting right over there. He is our founder and CEO. He is also one of our keynote speakers for today, so you'll hear from him shortly. I won't spoil the story. We also have Dr. Tonya Roberson, who I mentioned. She is our Executive Director of Community Engagement, Research Design, and Science. Dr. Tonya oversees initiatives that integrate community involvement, research, and scientific endeavors within Gila House. She's the bridge between research, science, and all of us. We also have Holly Betts. She's our Director of Clinical Trial Recruitments. She focuses on overseeing and driving strategies for recruiting participants for clinical trials, with a particular emphasis on ensuring equity, diversity, and inclusion, and also making sure that you feel comfortable throughout the process. We also have Bridget Carter. Hi, Bridget. With over 36 years of experience with the Cook County Department of Health, she now serves as a community health advisor within Gila House, and she works very closely with Dr. Tonya to help us fulfill that goal. We also have Kayla and Dr. Kareem Watson. Neither one of them could be here today. Kayla is our data wizard. She designs a lot of the surveys and forms that we use to collect information, and then she analyzes it and disseminates it. Basically, she turns the data into stuff that we can easily understand. And then you have myself. We opened up our Chicago office last year in February 2024. And although our office is in downtown Chicago, we do 95% of our work on the South Side. We are part of the Far South Coalition and the Chicago Health Equity Zones. We also work with Illinois State Reps Debbie Myers, Marcus Evans, and Alderman Mosley. Do we have any of the elected officials here right now? All right, so my few minutes of fame are up, and I want to thank you for your time and your attention. And without further ado, I will turn it over to the amazing Dr. Nita Lee, our first keynote speaker. Dr. Nita Lee is such a vibrant force in the medical community. She provides comprehensive and compassionate care to those diagnosed with ovarian, uterine, cervical, vulvar, or vaginal cancers. Let's please give another warm welcome to Dr. Nita Lee.
Hi there. Thank you guys very much for inviting me. I am so grateful to be here on Saturday. It's cold, but I'm glad we're all here together, because sometimes we do these things on Zoom during COVID, but I think in person is so much more better to connect. I'm really actually very honored to be a part of the Gila House and Dr. Roberson and Mr. Carter, who's like brought all of these things together, because I think it's a lot about connections and making sure we're making sort of personal connections and making sure we're understanding how everyone who's in this room, I think that you know, you being here is like the first step to kind of disseminating and sharing all of this information with those that you love and those that you want to protect as well. So I'm going to be talking about cervical cancer and HPV 101 in honor of the Cervical Cancer Awareness Month. But this is a year-long process. This doesn't start or stop in January, but this is a good beginning. And I really think about this as like what to know and what to share. I always have a lot of slides, but I try to talk not too fast, but we'll go through them because I'm excited to share some of this information. So I know that you're going to hear a lot more, but I actually think that this has actually been a slide on my slide deck of thinking about cervical cancer for many years. So this is why it's sort of full circle to be involved and be invited to speak at a Gila House event. So who was Henrietta Lacks? She was a 30-year-old woman from Maryland. She was born in 1920. She was a wife, mother, sister, cousin, patient, friend. She was a community member. She was a cervical cancer patient, and she was an African American woman. She was diagnosed 4 to 5 months after her birth of her youngest son, and she died at age 31 from an aggressive form of cervical cancer in 1951. And there's just so much to that, because as we're honoring Henrietta Lacks and the legacy that she's created, and we'll hear a little bit more about the issue of science and the cells that were collected as part of her treatment and what happened to that from Mr. Lacks as well. I really think that this, sometimes when I read about this, it makes me sad, because every day I see women who are diagnosed with the same thing that she was diagnosed with in 1950. And I hear about what she went through in terms of her treatment and her aftercare and how she suffered at different times, and I see the same thing happen, and I feel like this is a sort of a personal failure of our system. We lose every year in the United States 13,000 women who are diagnosed with, 13,000 women who are diagnosed with cervical cancer, and that doesn't even include the 200,000 women who are diagnosed with pre-cancer of the cervix, that may lose their fertility, or may lose, may have to have a hysterectomy, or may lose other things. And more than 4,000 women will die. In the worldwide, cervical cancer is 300,000 women, and in many countries, it's the #1 cancer in the country. So we're gonna focus on the US, but I feel like we think about, in their honor, we think about prevention, early detection, better treatment, and less toxic treatment. And I think that there's education in all of those 4 areas, and there's also research in all of those 4 areas that needs to be done and promoted. So fast facts: cervical cancer. Cervix is the opening of the womb, or the cervix. Anyone with a cervix is at risk. The most common age of women being diagnosed is between 35 and 44, and the average age is about 50. But 20% of cervical cancers are diagnosed after the age of 65. And that's really important to know, because women after the age of 65 are at a higher risk of getting later stage cancer, because people think they shouldn't get screened. And they shouldn't in some ways, but we've missed screening in some women before. We know that this is sort of the group, the median age, average age 50, and we can see sort of the distribution of like what percentage of different people are diagnosed at different ages. So again, the biggest group is in this like 35 to 54, but you can see how it's really important for all age spans really to think about. When we think about cervical cancer incidence, or who gets a new diagnosis of cervical cancer, this is some data that shows that there are disparities in terms of American Indian and Alaska Native women, Hispanic women, Black women, and where all of these differences are in terms of the rates per 100,000 of women getting this cancer. Then we think, though, also importantly, it's getting the cancer, but then who's dying of this cancer? And we see disparities there. And we know that Black women and American Indian, Alaska Native women are dying at higher rates. And that's been, unfortunately, very consistent, but that's what we want to change. And again, what are the age that different people, unfortunately, pass away from cervical cancer? And you can see the wide range, but the highest group is in this 55 to 64 age group. A lot of times those are women in their 40s and 50s and 60s who feel like, well, gynecology, I'm behind, that's over for me because I'm done having my kids, right? And the fact is that we actually still need to go get our care beyond reproductive health age because of issues like this. So we know that we can do better and no one should die of cervical cancer, but ironically, sometimes you'll hear on the news, cervical cancer rates are decreasing, which is great, right? So we want them to decrease. And we've seen decreases in younger women who've gotten the HPV vaccine. But we're actually seeing increases in certain areas, especially in increased rates of higher stage at diagnosis. And those are people who are getting missed in the screening. So we're not getting as many women diagnosed at early stages because we're catching them through prevention, through vaccine, and maybe getting a PAP and HPV test. But those that we're missing, we're actually seeing higher rates of stage 4 cancer showing up because those are the people that we're missing. And this is really important because we've actually seen studies showing that in lower income counties, that's what's going up, regardless of race, regardless of ethnicity. So we know that screening saves lives. We know that from the 1950s onwards, we saw dramatic decreases in the number of women getting cervical cancer because of PAP and HPV testing. But it's sort of a Swiss cheese effect. Like, some people get missed in multiple different places and multiple different times in their life. And it could be because they missed their screening. They got screened, but they didn't know they had an abnormal and didn't get the right follow-up. Their doctor never told them about screening, even though they saw them regularly for high blood pressure. They're uninsured and they're scared about the cost. We have free cervical cancer screening programs in Illinois, and you can find me afterwards to find out about those. Patients living in rural areas, disabled patients who are difficult to do an exam and do a pelvic exam. Patients who are immigrants and are scared to seek health care because they're scared they're going to be reported in some way. Or immunosuppressed patients who have transplant or HIV and have to be on medications, can have a depressed immune system and can be at a higher risk for cervical cancer and HPV-related cancers. So we see a lot of missed opportunities. So this study was that 7 out of 10 women who were not screened had a regular doctor and had health insurance. So it's not always about insurance, but a large portion is, right? So thinking about what we can do. So HPV is the virus that we'll talk about that causes cervical cancer and other cancers. Cervical cancer can affect normal cells in the body and can then lead to HPV infection. Not all HPV infection will lead to cancer because sometimes your body can clear it by itself. If you're immunocompromised and your immune system's not working, or you're smoking, that can affect your immune system, and then maybe your body doesn't clear it, and then it goes on to precancer. We still have a chance to catch it there with PAP tests and HPV. But what if we don't catch it there? What if we don't go for our follow-ups, or we're in a busy clinic and we don't have a good system set up to contact our patients? Then we miss it, and then we can turn into cervix cancer. So there's a lot of different reasons this can happen. So 1 in 4 people were not up to date with the recommended screening. 58% in screening rates were lowest amongst uninsured patients, recent immigrants, and people without a high school education. And this is not to stigmatize all of those groups. It's just to say there are structural reasons why it might be hard. Maybe if you did not have a high school diploma, maybe your job isn't as flexible and you can't take time off, right? Maybe you're worried a little bit more about, recent immigrants may have other priorities in terms of housing or food that can keep them from getting screened. Or uninsured people may have just not knowledge of where else could they get screened. So again, we may have prior health encounters, but we miss screening. People may not be asked or remember. Doctors may not tell people to get screened. They don't have opportunities to be screened by women's health providers, right? They may be a member of the LGBTQ community and they're scared of that. Or they may not report prior sexual activity, so they think that they're not at risk. So there's a lot of barriers to screening, and this is really important. So I think the breast cancer community has done an incredible job breaking down the barriers about just talking about cancer, right? Our cancer survivors and have done a really great job in cervical cancer as well, but there's more stigma to below the belt, right? So I think we finally got over the stigma about talking about breasts and feeling comfortable with that. But there's a lot of stigma to talking about anything below the belt. And so there's stigma, there's other health issues, people don't have time, the provider doesn't recommend it. Exams are uncomfortable and not fun. Who wants to do that? We work with a group that does a lot of breast and cervical cancer programming and navigation, and they say, you know what, time for time, people are like, yeah, I'll get my mammogram, but I'm not going to go to my pap smear because that's just too uncomfortable, right? So we need more research in how to get that better, right? Self-test is coming out soon. An HPV self-test may be a way to increase people's comfort. Lack of navigation, insurance, fear, embarrassment, shame. Prior abuse and trauma is another reason that many women do not want to get a pelvic exam because it's uncomfortable and triggers them. And this is important to think about for providers. And I like to say screening is a process. The PAP and the test is just a screening test, but the process is, did you get your results and did you get follow-up? That's the main thing. It's a process that needs to be done. So what's happening in Chicago? Here are rates of cervical cancer diagnosis by neighborhood and community area. And you can see in the darker red where we have higher rates of cervical cancer diagnosed. And we sometimes look at these rates and say, hey, this is where we need to target more education, more navigation, more free services, or more HPV vaccine. But it's really important that, unfortunately, these are also aligning where we know that we have Black and Hispanic women living. So Hispanic women have a higher rate of diagnosis, but Black women have a higher rate of death to this cervical cancer. And these are kind of disparities that are really important to study at the local level. And this is the death rate in cervical cancer in our city, in Cook County, rather. So one thing that I always like to have up here is understanding the pelvic exam, because it's very confusing. There's a pelvic exam, and then there's a pap smear, and those two things are not the same. So the pelvic exam is usually done annually. It can be sometimes a little bit less frequent. Pelvic exam has two parts, and this is where I know we have a lot of group in the room, many of whom have had speculum and pelvic exams, and many of our male attendees who may not know, but I'm going to say it all out loud anyway. There's a speculum exam where you put the little device inside to take a look, and then there's a bimanual exam where we actually do an exam with our hand to feel. So we can look and see problems of the cervix, the vagina. We can feel the size of the uterus and the ovaries. We can test for STIs or sexually transmitted infections, but we can test separately for the PAP and HPV test. But sometimes people have a pelvic exam, but they actually didn't get the testing done. For example, in an emergency room, somebody who goes in for bleeding may have a pelvic exam, but they will never get a pap smear because that's not where pap smears are delivered. So that's really important. Sometimes women say, well, I went to the ER last year and they told me everything was fine because I had a pelvic exam, but they didn't actually have a test to see if they had HPV, which causes all of this. So a pelvic exam does not mean a PAP or an HPV test was done. So how do we screen for cervical cancer? A PAP test is a little swab that checks the cells of the cervix to see if there's any pre-cancer changes. And an HPV test tests for DNA of the HPV to see if you have the type of that can cause cancer, the high-risk types. There's hundreds of types. They don't all call cancer. Usually we start at age 21 and go until age 65, but if you've not had regular screening up until age 65, or you have any symptoms, the screening or the testing should continue after age 65. And that's a little fine print that people often ignore. So coming soon, HPV self-testing is going to be sort of doing it like a swab that you can do in your own bathroom. I'm hoping and getting that out into community centers and into primary care doctors where they don't have somebody to do a speculum exam is going to be very important. So how can cervix cancer be prevented otherwise? We talked about the screening, but HPV is also another really important thing to focus on, and the HPV vaccine is cancer prevention for cervical cancer and other cancers that affect us, including anal, vulvar, vaginal, and oral and head and neck cancers in men and women. So risk factors for cervical cancer, essentially HPV infection causes cervical cancer, and if your body can't clear it by itself, that puts you at risk. There are some other things that are related, sort of starting sex at a younger age can be related because your cells are more vulnerable. Having increased number of partners or a partner who had more partners. Again, I don't want to say that there's stigma because anyone who's ever had a cervix, you could have had one partner and that's it, right? And so it's not that, but just to know what that is. Smoking or secondhand smoke, weakened immune system like we talked about. The biggest risk factor is not having a PAP test or an HPV test and not getting the vaccine. That's the biggest risk factor. That's kind of the only one that matters in some ways. I mean, the other ones matter too, but that's where we can catch everyone. So stage is where the cancer is found at the time of diagnosis. When cervix cancer starts, it starts really tiny in these cells microscopically, and that's where we want to catch it, where we can catch it and cure it by just removing a little small part of it, or maybe removing the uterus if you're done with childbearing. As it goes further and grows into the vaginal area or grows into the side tissue, that's called regional, and we're less likely to have people be able to survive it. Then it can grow into the lymph nodes, which is the gland system, or it can go elsewhere in the body. And then we're a little bit more less likely to be able to cure people. We still do, but it can come back. So we know that an early cancer can be treated with surgery, and a larger cancer can be cured with chemotherapy and radiation. So it's important to kind of think of these things, but the larger the cancer, you may have a little more long-term side effects, and that's also another area of research, like how do we get better treatment with less side effects? I put this up here, but this is from before, that cervical rates cancers are increasing in poor counties, and so it's just important to kind of think of the public health things of what we need to do. So symptoms of cervical cancer. So obviously early cancer may not have symptoms, but these are symptoms that maybe cervical cancer, sometimes uterine cancer can also have these symptoms, and ovarian cancer, but irregular bleeding, bleeding after sex, pain in the pelvic area, irregular vaginal discharge, bleeding after menopause, difficulty urinating, having a bowel movement, leg swelling, back pain. Those are for like more advanced cancers, but any of these symptoms, it's not that you're going to have cancer, but it's good to make sure that you advocate to get it checked out. Another really important area of research is treatments for cervical cancer that are advanced or recurrent, and these are research areas. New biological and chemotherapy drugs that are FDA approved, these all require clinical trial participation, and we know that minority women are way underrepresented in clinical trials for cervical cancer, which is the irony of like, this is who is getting the cancers, but we're not putting everybody in the same rates in trials. Immunotherapy has been a game changer for me in treating patients, and cancer treatment vaccines, which are in the very early phases of research. HPV, we talked about this a little bit. Human papillomavirus, 200 types of HPV, can be harmless, can go away, but if it stays and gets persistent, it can cause trouble. Talked a little bit about this, but these are sort of like the cells that we're looking at under the pap smears to say like, hey, what do these cells look like? Are they infected? Is it going back? Is your body clearing it? Or is it persistent and it's going to turn into precancer or cancer? So HPV infection is so common. It's like a common cold. Everybody has it. 80% of people are going to be exposed to HPV. So it's nothing to be ashamed of. It's just that we all have it. There are 43 million infections in 2018, and these new infections happen annually. 80% of sexually active people have been infected by HPV, so this is something that all of us need to do. And look at the cancers that HPV can cause. Vagina, penile cancers, vulvar cancers, anal cancers in men and women, cervix cancers, and head and neck cancers. Head and neck cancers in the United States related to HPV are increasing. So that's back of the throat cancers, and it's increasing in men. So that's why HPV is important, vaccine is important for boys and girls. So this is sort of all the cancers, the precancers, the warts, the abnormal pap smears, and the stress and anxiety that this can cause. In general, cervical cancer screening recommendations, the ACS recommends 25 to 65, but I really do think that I kind of keep my, and I'm going to put this slide in later, I still think 21 you can get your screening done at HPV, and so even though ACS recommends it, I would say that not everyone has access to the HPV testing at 25, so PAP starting at 21 is what I would still recommend. It's transmitted via skin-to-skin contact. HPVs that are specific to genital areas, it's kind of considered a sexually transmitted disease, but it's so common that I have mixed feelings about how to classify that because we all have it. We know pap smears don't mean that you have cancer if it's abnormal, and most of the time it will not be cancer, but will need a follow-up. Colposcopy is just a magnified view of the cervix if you have an abnormal pap smear, so don't be scared of that, but knowing that we may need to do more checkups. And again, 21 to 29, you can get your HPV test by itself, your pap smear by itself, or your HPV test. But the most important thing is knowing what your test results are and getting follow-up. So we can't just screen, we need to vaccinate. And the vaccine guidelines are starting at age 9 to 14, up until age 15 to 26, and now up until, and it is cancer prevention, up until age 45. And these can prevent the cancers that we discussed. And that's really important because we're seeing more and more of these cancers happening. We want to think about who should get those recommendations, but I think it's really important to know that up until age 45, you may be eligible for HPV vaccine. Other issues, we're not vaccinating enough children in the US. People are scared of vaccines and concerns, and I'm happy to answer questions about those. Worry about early sex if you get the vaccine is just not true. There have been many studies shown about that. The cost is covered for children. And low provider recommendation, which is on me and our group, right? Like if we don't recommend it, how's anyone gonna know to do it? So that's another area that we work on a lot. Other things you can do, getting screened for cervical cancer. If you're of the age and you have a cervix, encouraging others to get their screening. So I would sort of like ask of everyone who's here, ask the people in your life, hey, I went to this talk and are you up to date? Like those are just those simple questions actually really go further than me standing up here, right? Hearing from someone that you love and making them go, you know, getting the HPV vaccine and promoting awareness and getting boys and girls vaccinated. So who can be an advocate? Everyone and anyone. All of us have a unique perspective and voice, and all of us have a unique sort of social network that we can spread this information to, which I think is really important. The way that you can advocate differs. One-on-one discussions, share this with trusted friends and family, in person, create a community quorum like we're doing here, social media, careful with your sources, and get involved with different groups like Gila House. This was a patient of mine back in 2016 who took her own diagnosis and survivorship. She had to have surgery and radiation, and she was a crocheter. She liked to crochet. She did things, and she decided what she was going to do was going to go crocheting hundreds of these little ribbons. Thousands, I think she made, and just put them in the grocery store. And connected to that was information about where to get free screening in Illinois and some resources. And she did this everywhere. She said she put it in movie theaters, she put it in the grocery stores, she put them everywhere. And so we just think about these small steps. And then she also got the state of Illinois to proclaim Cervical Cancer Awareness Month in January. So I think about her often in terms of thinking about what we can do. So again, newly diagnosed cancer is a missed opportunity, a failure of our system. We want to work hard to kind of make that not a thing for people. I always think, again, like there's all sorts of different advocacy, and I think Gila House is kind of bringing in a lot of this different things, empowered community advocacy, healthcare advocacy, research advocacy, self-advocacy, right? What are you doing for yourself and your local. And again, a more focus and research that I'd love to talk about as we go through things. And a very, very big thank you to all of the groups who are here and represented, because I think this is this means a lot to so many of us on a personal level. I think I do, just as we talked about Henrietta Lacks and the person that we lost many, even a generation ago. I think that there are women and families who we lose every day, and many of those are women who I became very, very close to as a provider and as a friend. And I think that those are the people that we really need to kind of like keep doing this for. So I thank you for allowing me to talk today.
It's a lovely day, right? Ancestors. You know, my great-grandfather is William Foster. Now, y'all got to look it up. But he is the first black film producer, and he's out of Chicago, and he wrote under Julie Jones for The Defender for a long time. That's my grandmother's father. And there's a great long story about how he was able to, the story goes because he had lighter skin color. He was able to secure resources and capital to shoot films. So he was actually the first. He did the first short. So Oscar Michaud is credited as the first long full length, but my great-grandfather. And I'm only saying that because history is important. And our next speaker, his grandmother holds some history, and she is almost the cure of the nation, right? For real. And we didn't know enough about her growing up. Not at all. Nobody talked about this story, and because nobody wants to let you know, because I'm sure some folks didn't want to let other folks know who they were getting all this information from. So I am privileged, and it is just an honor to be able to introduce our next speaker. He holds a key to some black history for real, and he had time today to come in town and talk about, we're special right now. Well, who we're about to talk to and listen to, this is a privilege. A lot of folks, I think, would want to be in this room right now, because and now we can tell our grandchildren about it, but they should be in the room really right now, because it's the type of information that makes them proud and them go to school and say, no, I can be a doctor too, because I know that they're using all type of medical research. Anyway, put your hands together right now, ladies and gentlemen, for Mr. Alfred Lacks Carter Jr., Henrietta Lacks' grandson, y'all. Legacy legend. Yes, privilege and an honor.
So it is such a privilege to be here in Chicago. My voice projects a little bit, I'm sorry. Thank you, David. I would like to thank Dr. Nita Lee, who is very instrumental to Gila House. Also, I'd like to say a prayer for Dr. Tonya Roberson's mom. Dr. Roberson couldn't be here today, but she's in our prayers and in our hearts. She's very instrumental in the Gila House. Gila House is an organization that I founded a year ago here in Chicago. Actually, it's a extension of the Henrietta Lacks House, which I started back in Baltimore in 2016. It was originally a transitional housing program for men returning home from incarceration. Myself being an ex-offender, doing 15 years in Maryland State Correctional System, I understood the importance that men needed help when it was time to be released. When you're in the prison system, and if you don't have a home plan or a healthy environment to go to, they won't release you, and you'll be stuck. So I created this for men to come home and come into my program because I wanted to meet these guys where they were at, because I had been there and I had done that. I'm the proud grandson of Henrietta Lacks, and I'm the son of Deborah Lacks. My mother, how many young ladies in here never knew who their mom was? There you go. My mother never knew who her mother, Henrietta Lacks, was. My mother was 2 years old, when Henrietta passed away in 1951. So can you imagine growing up with all brothers, a dad, and the majority of men, cousins, not knowing who your mother was? You don't know how to be a young lady. You don't know how to be a young girl. All these burning desires my mother experienced at a very young age. My mother went through the pain of not only not knowing who her mother was, but being unprotected and being taken advantage of by men in the family, which is such a travesty. So it's like what happened to my grandmother, Henrietta Lacks, on that day that she went to Johns Hopkins Hospital, diagnosed with cervical cancer. She had no clue that her life would be cut short in 8 months with 5 children. She went to Johns Hopkins to receive treatment. But what did Johns Hopkins do? They didn't give her treatment. They used my grandmother as an experiment. This doctor at Johns Hopkins had been trying to find human cells that would stay alive outside of the body, but they never would. They might stay alive a day or two, but they would always die. But not Henrietta's. When she passed away, her cells continued to multiply. When she was lying on the table at Johns Hopkins Hospital after they did the autopsy, they had the nerve and the audacity to go back in there and steal more cells from my grandmother. They stole her cells. When they stole her cells, the doctor, George Otto Gay, he went on the steps of Johns Hopkins Hospital and did a press conference and told the world that he had discovered the first immortal cell line on the day that Henrietta died. Oh, they didn't say they came from Henrietta Lacks. He said these were called HeLa cells. Unbeknownst to my family, these HeLa cells will go on to be the most instrumental tool in medicine. Her cells were used to create the vaccine of polio. Her cells were used to create the vaccine to COVID just recently. Everyday products that we use today, such as soap, toothpaste, I hope we use soap and toothpaste, those products are tested with the HeLa cell. Medication that we take, tested with the HeLa cell. The HeLa cell was used to test zero gravity in space. So a black woman's cells were the first to go into space. Her cells were used to test the effects on the atom bomb, the atomic bomb, which is radiation. And lo and behold, all these years later, the HeLa cell is still multiplying. Over 100 million metric tons. Can you imagine that? That's like 100 Empire State Buildings, guys. The magnitude of an African American woman from Roanoke, Virginia, that migrated to Baltimore, Maryland, cells are still living in laboratories all over the world. I guarantee you, if you go anywhere in the world and you go to a laboratory and say, do y'all have any HeLa cells in here? I'll bet my last dollar that they'll say yes. Because without the HeLa cell, a lot of these advancements wouldn't have came to be. There are over 17,000 patents derived from the HeLa cell. It's been 4 or 5 scientists that does work with the HeLa cells that have won Nobel Peace Prizes. And it's just such a profound, like I get emotional when I think about it, because this has never happened, ever. And I don't think it will ever happen again. This is such a God thing. And it's God's timing that all this is happening right now. It was a few years ago. My papers. It was a few years ago that I came here and I did a speaking engagement at University of Illinois, Chicago, and I was alongside of the great Dr. Robert Wynn, who's a great person and an extraordinary medical mind. And I'm surrounded by extraordinary medical minds that share the same desire and passion that I have to go into communities of color to help people to know that we want to teach people that your health is your wealth, because you can have all the money in the world, but if you don't have your health, it means nothing. So we need to communicate. We need to talk to each other. We need to talk to the people in our families that came before us to learn from our past, because Dr. Tonya always says, let us learn from our past so it don't deter us from a healthier future. Because if I know that cancer runs in my family, then I know I have to do certain things to avoid these pitfalls and these medical mishaps that may happen if I become a smoker, if I become a drinker. So I might have to change my diet. I might have to exercise more. Believe in empathy and transparency, because when you're transparent, then you're giving everybody a clear view of what's going on and what's being done in the community. We believe that clinical trials, it has to be diverse enough to gather accurate data. You know, a lot of times the medical field want to know why people don't want to participate in clinical trials, and why is it so difficult recruiting people of color? Well, it goes all the way back to the 1800s with slavery. We used to have doctors like James Marion Sims. I'm sorry, we want to get his name right. James Marion Sims. Have anybody ever heard of him? Dr. Nita says she know. Well, James Marion Sims was crowned the king of gynecology. This man was doing experimental procedures on enslaved black women back in the 1800s. And not only was he doing these procedures on these women, he wasn't using pain medication, because back then, and even till today, some people still might have the misconception that black people are more susceptible to success. We take pain more than other people, which is not true. They saying because the melanin in our skin and the size of our veins and things of that nature. And it's one young lady named Anarcha that this man operated on over 30 times. 30 times. He also was operating on newborn babies that had bacterial infections in the brain. He was using shoemaker tools to separate their skull. And he had 100% fatality rate in every one of those procedures, and then was using these children as dissection subjects afterwards, and thought that he wasn't doing anything wrong. When medical schools needed bodies to do clinical work on, they would go to slave cemeteries and dig up bodies that were freshly buried, putting them in barrels of liquor. Now, all this stuff is documented. They were putting these bodies in barrels of liquor, transporting them to whatever medical research place they were going to, take the bodies out, do whatever research they were going to do, then throw the bodies in the gutter, or they would incinerate them. And guess what they did with the liquor? Sold it. That's where you get the term rock gut liquor. Have anybody ever heard that? He's drinking rock gut liquor. That's where that term comes from. You can look it up. I'm speaking truth. I'm speaking truth. And, you know, it's all a part of the racism that has been going on in the medical field since the beginning of time. What happened to my grandmother in that colored ward was barbaric. They were sewing live radium onto her cervix. Live radium, which was burning her from the inside out. They knew what they were doing. You know, so racism includes system policies and practices that aren't equally heard for black people, because it's like barriers for black people. They call them barriers to care. You might live in a community where there's no public transportation to get you to the facility where you need to get treatment. You know, so diabetes and hypertension and obesity, asthma, all these medical things that happen to people of color, it usually happen to us because of where we live. They always put us in places where there's a lot of pollution. We don't live in the suburbs and where the trees can oxidize the air and things like that, clean it up. Where I come from, all you smell is automobile fuel and gunpowder. But what can we do to eliminate racial and ethnic differences? You know, we need to talk to our public health professionals. You know, in the black communities, we must continue to conduct and share research about how racism impacts health. We have to do that. I brought my book here. We were supposed to have some books here for people. So what we're going to do, we're going to have a sign-in sheet. And if anybody wants to get a book, we'll make sure you get one. Just put your name and your contact information, and we'll contact you. But my book is called Shadows of Immortality. And this book, I'm going to read the back of it to you. It says, overcoming drug addiction, crime, and a 30-year prison sentence, Alfred Lacks Carter Jr. defied the odds. Listen, y'all, I came through the fire. And it's only by the grace of God that I'm standing here before you today, because God has something for me. And it's vicariously through my grandmother and my mother. That's the reason why I'm here. He emerged determined to reclaim his life as the living legacy of his world-renowned grandmother. Henrietta Lacks, immortal healer cells have saved over 10 million lives, contributing to countless medical breakthroughs. He is now revolutionizing the Lacks' legacy to impact and inspire even more lives. With a poetic pen, Carter shatters the chains of silence, exposing pitfalls and injustices marginalized communities face. And in his debut memoir, Shadows of Immortality, he chronicles his journey to redemption with unflinching honesty and unwavering hope. This book right here tells you that you can overcome anything. Anything. Drug addiction, coming from a broken home, domestic violence, you name it, I've overcame. So I'm an inspiration. I'm a living testimony that if I can do it, you can do it. I'm from Baltimore. I know Chicago rough, but per capita, Baltimore is like little Beirut. I'm telling you, it is crazy. And God put me here for a reason. He put me here in Chicago for a reason. I told David last night, I said, sometimes you got to leave where you are to get where you need to be. And I need to be here to help people learn about their health. Now, I know I took up enough of y'all time, but I just want to say from the bottom of my heart, the Lacks family, we stand in solidarity, and we're going to make this health thing understandable. I came up with the word because when it comes to science, there's a lot of terminology that everyday people like myself don't understand. So the Healer House and my team, we want to de-scientificate. We want to de-scientificate the medical field so we can all understand. So with that, thank you so much.
One more time. I was trying not to tape the whole thing. First of all, you're going to get some t-shirts made that say de-scientificate. The Gila Foundation, my marketing mind started going, Matt, you need to coin that phrase quickly as soon as you get home. Okay, yeah, don't even say it out loud. Don't even say it. What a treat. You all, I have heard there's so much more to his story. I'm getting the book, but I guess we didn't have enough time, or make sure you come back and hear him tell it again. But how they found out that Henrietta Lacks was in line and who she was is a whole other story at the party. I remember that. And it's just, disparities. They don't want you to know, and so they try to take it all away. They almost didn't know, but that's another story. We have a little time for some Q&A with Dr. Nita Lee. Dr. Nita Lee, please come join me. There are a couple things, like the HPV can lie dormant for 25 years. Is that right?
Yeah, so HPV infection, it's, everybody hears about like shingles. You may have had chickenpox when you were 9 and then like 72 and like, why did I get shingles? So certain viruses like certain parts of the skin and can hide there. So the shingles virus or the chickenpox virus can actually hide where you had your chicken pox, and they can show up in like one patch like shingles. HPV is very similar in that it likes to hide in cells of the cervix or the vagina. And then sometimes years later, when there's like maybe your immune system isn't working as well, or something's changed in your body, or stressors or things like that, that's why it can show up again. Even if it wasn't a new infection, sometimes it could be a new infection, but sometimes it can show up again. And that's why people still need pap smear and HPV tests. Like maybe they're not sexually active anymore, and they're like, well, that's not something that's worrying me anymore. I haven't been sexually active for years, but it can still be in your body.
Okay. Yeah, pay attention to that. Did we have any questions? We have one microphone. Yes. Do we have two microphones? Yeah, come on up. Oh, can you? Okay.
This seems like a long time. Yeah. This is really controversial sometimes because as a gynecologist, I like to see everybody once a year, right? To kind of say I still need, and I think that's still true. Now, it doesn't mean that you need the pap test done and the HPV test done every single time. So those 1 to 5 year recommendations, like coming every 5 years for your testing, doesn't mean you should only go every 5 years. It actually means that like the pap test only needs to be done every 5 years if you've never had a history of abnormals. If you've had any history of abnormal pap smears, that rule is out the door and you actually have to go annually. But if you've had negative, the signs and symptoms you should look for are changes in your period, bleeding between cycles, if you're postmenopausal, any bleeding that shows up, pain during intercourse, new bleeding during intercourse, like you were having sex and like all of a sudden a couple months go by and you're like, I'm bleeding after every time I have sex and I've never had that before. All of those symptoms, new pain that doesn't go away, are all things that you should be looking out for. And then in terms of testing, getting an annual exam every year is still recommended so people can look and then make a decision about whether or not you actually need to get testing more frequently, because some people's personal plan for cervical cancer screening is every 1 year or it's every 3 years. The general public who has no history of HPV or no history of abnormal pap smears can sometimes go to every 5 years, but that's like few and far between. So we have to be careful about when getting screened. Mm-hmm. Uh-huh.
Mr. Carter. Thank you, Mr. Carter. What about women over the age of, like to say, starting at 55, that may have already not doing a period anymore, have maybe even had a hysterectomy or tubal ligation, and their PCP tells them, which they're gynecologist, which you are, and I know you're going to answer good, that they don't need a pap smear?
Great question. So if you've had a hysterectomy, which is the removal of the uterus and cervix, because some people can have only supracervical and they still have a cervix. So if you know you got your cervix out and you did not have that, the reason you had the hysterectomy was not because of cervical cancer and it was not because of precancer, and you've never had a history of abnormal pap smear, those women can stop having pap smears, but they should still have the pelvic exam to check on their ovaries, the vaginal areas, the other external areas. So yes, that's true. If you stopped having periods, but you still have a cervix, you still need pap smears and HPV tests.
Tubal ligation, the tubal ligation, a total hysterectomy, but you kept your oral lines, and basically it's nothing to do with cancer. It's because you have fibroid tumors, and fibroid tumors, we all know, are parasites. They grow. They don't dissolve. They get worse.
So if you had a tubal ligation, you still probably have a cervix, and you should still get pap smears regularly until age 65. If you had a hysterectomy and it wasn't for anything related to cervix, then you could stop having a pap, but I still want people to go to the gynecologist to check out the below the belt parts. I love talking about this because partial, people always come and say partial. And so the confusing thing is that people mean different things by partial. Sometimes people mean a partial meaning like they took my uterus, but they left my ovaries. But removal of ovaries is actually like a separate procedure almost. So if they had a hysterectomy, if you had a total hysterectomy, that means that you took out the cervix and the uterus. If you had a partial, it's not technically a term, but most people mean that their ovaries were left inside.
Yes. I was always told that after 70 that you didn't need a pap smear. And I want to know if that's true.
We got you.
I want to know if that's true. And I was actually told by a doctor that after a certain age, you don't need not a breast exam. But I said, so she said, what would you do if you got cancer? I said, I don't know. And she said, well, you don't need to get a breast exam if you don't know. I mean, to me, a doctor should never say that to a patient.
I agree 100%. So it's sort of the difference between like the general public health guidelines and what you want to do as an individual, right? So there are people who may be 80 and are not in good health, right? And maybe their priority is not necessarily finding out about anything, and they have other problems, right? And they're not doing, and they may choose to decide, I don't think I want to get screened because I know that I don't want to do something. And that's a different story, right? But I have some patients who are in their 80s that are healthy, and if somebody told them they had breast cancer, they would sign up for surgery, they would get their, their medication, and they'd be treated, and they'd live to be maybe 100, right? But I think the difference is that there's guidelines, and there's also like knowing what you want to do as a and there's a little bit of a tricky balance. For women after age 70, some women don't want to go to see a gynecologist, but we always still think it's not the worst thing in the world because people can get cancer on the skin on the outside. People can get vulvar or vaginal issues. So it's always good, but I think it's up to the person as to what they feel like they want to do, but I always encourage it.
Okay. All right, that's fine.
Thank you. My daughter, so that generation, that's the millennial generation, they were encouraged to get the HPV shot, the vaccine, until I think it was a series of 3 before age 18. Now, for my generation of baby boomers, fast forward, can we get it now? Would it prevent anything, or is it like too late?
So the vaccine is recommended for starting at age 9 up until 26, boys and girls. It is also FDA approved up until age 45 for men and women. After 45, there just have not been enough tests to know if it's as effective because we know immune responses are stronger when people are younger. So the question is like, after 45, is it going to be as preventive or not? We don't know. So it's not recommended because it's not necessarily as effective. Now, it doesn't mean that there aren't people who say, you know what, I have a transplant issue or I have some other issue that's making me more immunocompromised and I'm going to get the vaccine. You could still get it, but it may or may not be covered by insurance, right? So there's all these like other things that can come up, but the best age and the most protective is between 9 and 45. But what that means for any of us who's older than 45 is that we have to get our screenings done to make up for that, if that makes sense. But people who have vaccinated still need screening too. They still need screen. So even if you got an HPV vaccine, you still need to get a pap and HPV test. All right, where are we?
According to my lifestyle as a Hebrew Israelite, we don't believe in taking vaccines. So is there a dietary process that, as far as you are what you eat? I don't eat swine, I don't eat catfish, I don't eat shrimp, I don't eat no bottom feeders. That helps keep my system clean. For this vaccine, like I said, I don't take vaccines. I haven't taken a vaccine in 50 years. So what is it that we can do dietarily other than taking some medicine that some scientists said that might work, might not work, or therefore, what would be your suggestion?
For everybody who didn't hear, he said he doesn't take vaccines. So what could he do dietarily to prevent HPV?
So there isn't like one set diet, but I do think that there is a lot of what you're saying that people have to think about, like in general, we know from large studies of people just, all over, just when they report back their diet, like what did I eat, and they study people going forward and say, who got cancer, who didn't get cancer. We know there's certain trends. It's not perfect, right? Because you could have somebody who ate like the worst food in the world and they lived to be 100 and they never got cancer, right? Or the person who smokes cigars till they're 100 and they're like, how are you alive? And but there's always exceptions to the rules. But in general, we know that like less processed foods, so foods that are more from natural ingredients, cooking at home, more fruits and vegetables, and less red meat and less processed meats are kind of like these trends that show up that are really hard, because that is also stuff that I hate to say it, but companies are making things that actually taste good and trick our bodies into thinking that that's what we want. I can give you a whole lecture on like the microbiome and how your gut gets tricked by certain foods, right? And we have to retrain our guts to actually crave healthier foods. And so it doesn't answer your question about HPV and vaccines, but it does mean that it may promote a healthier environment that your body may be able to fight things off better.
Stay out of Chick-fil-A and McDonald's.
I just want to say the alderman is in the room. Alderman Mosley's in the room. So my question is, I have a 12-year-old grandson, 12 now, and they don't want you in the restroom with them. How do you know, or how do you look for HPV? Because they're not going to let you look at them. If they were 6 or 5 or something like that, you can bathe them, but they're 12.
So most boys and men actually will not have any external signs of HPV. And so for somebody who's 12, or for a kid who's 12, there's nothing that you need to do to look, because he's probably never even been exposed to HPV. That's the reason that we want to vaccinate when people have never been exposed to it, because that means that there will have the memory. So in the future, if they ever got exposed to HPV, their body will be able to mount an immune response and stop infections. So it's really not about checking anything, testing anything. It's really just a cancer prevention that actually protects them when they're much older. So nothing's going to happen to them when they're 12 or in 26 or anything else like that. But kids who've gotten the HPV vaccine in their teen or under teen years actually are showing up, like when they're adults, we're seeing less head and neck cancers in men for those who got vaccinated. And so it's more like a thing. There's nothing you need to do. It's proactive. You don't need anything to do testing. It doesn't have anything to do with sex. Doesn't have anything. It's more proactive for if anybody ever gets exposed to that virus randomly in the future, they're already protected.
And in between questions, we brought 75 colon cancer tests. So if anybody want one to take home, and you can take the test and take it to your doctor. You get the results yourself. So that's up to you.
Hi. So first of all, I want to thank you, Dr. Lee. You were actually my mother's doctor, Evelyn Hannah. So she died in 2022. So my mother was part of the 20% that get cervical cancer over 65. She was actually 85 when she got diagnosed. My mother was a registered nurse, and she gave Dr. Lee a lot of pushback. And my sister and I, we would be sending Dr. Lee messages, and our mother would say, tell her I am not having surgery. And she just would not have surgery. We believe she knew she had cancer, and it wasn't until she got really sick, and we had to rush her to the ER, and they had to do emergency surgery. But by then, she was just too sick. But my question is, as my mother's daughter, am I more likely to get cervical cancer? Is that a cancer that has a genetic portion?
So I thank you for being here. I actually do remember your mom. No, cervical cancer in general is not genetic. So it is usually not necessarily seen in families due to like a hereditary cause, meaning like passed on. And HPV also is not really passed on. There's some really rare instances of HPV being passed on to newborns, but it's super rare. So it's usually not something. But I will say that sometimes there's things that are not hereditary, but that can be environmental, right? So like creating new, like healthy family habits of saying like, like my mom had this, and therefore I'm gonna just be making sure I'm up to date with cervix cancer screening, and my kids and grandkids are getting HPV vaccine because you're breaking that cycle. So it's not hereditary though, so that's good in terms of things, though other cancers can be. Yeah.
Is there any research or connection? So I do remember when my mother went through menopause, she took hormone therapy. Is there any connection between that? Because I absolutely was like, I'm not doing that.
There's not a connection between hormone replacement therapy and cervical cancer. There's kind of a low-level connection with breast cancer and hormone replacement therapy, and some hormone replacement therapy can actually be protective against uterine cancer. So it's sort of this mixed picture of like what your individual risk is and then making that decision. Because there are some people who really need it and, are suffering quality of life, and so it's always a personal decision, but cervix is not one of them. Yeah.
Yes, sir, Mr. David.
Hello, everybody. My name is David Sanders, and I'm one of those people from Baltimore, by way of Salt Lake City, Utah, by way of Henrietta Lacks, because I was over here at the Hines VA Hospital with colon cancer, and that was where I met Alfred's grandmother in a medical encyclopedia, because it was the procedure that was tested using her HeLa cells that saved my life. So I'm here to tell you today that if you think that she's just something from the past, no, she's from now and now on. You can rely upon the science that came from them stolen cells, and it's our time to take the cue from her and to go forward. Because when they told me who she was, I grew up right down the street from Henrietta Lacks. Right down the street, Turner Station, Maryland, look it up. And I ran around that hospital saying, do you know Henrietta Lacks? Do you know Henrietta Lacks? And now I get to know Alfred. And this is like the top of the mountain for me. So I want everybody to understand the value of Henrietta Lacks is not just in the amount of cells that she produced, but she saved my life. Saved my life. Thank you, Alfred.
One more question for you. Oh, do we have any more questions? Can I ask one question to Mr. Put you on. So I thought your talk was so powerful, and it really talked about it's such a legacy. And I wanted to see, because I think you've spent so much time developing HeLa House and thinking about that issue of science and medicine, and how do we, from my end, I feel like a lot of clinical trials are our teams just don't ask. Right? So it's not always about mistrust. It's about nobody told me, nobody asked me about a clinical trial, right? But what makes you feel more confident, or how do we take all the stuff that we know that is bad, right? The racism, the ongoing bias, all that stuff. It's real and it happens and it keeps happening. How do we change that from that to going towards trials and thinking about research and engaging more people to feel comfortable, and then also our researchers to feel comfortable? Does that make sense? You know what I mean? It's such an emotional thing that you presented, and how do we go from that to knowing what the next steps are?
Well, I really think that the value of knowing the importance of the future. Henrietta, she passed away in 1951, and her cells are still helping people today. We know that her cells were stolen by that doctor at Johns Hopkins Hospital, and he distributed them all over the world, and then said that they never made a dime, when these pharmaceutical companies are making billions of dollars every year, and our family couldn't even afford health care. My uncles, and my mom, they struggled to get adequate health care when their mother helped the whole entire world. It's because of, the title of my book, Shadows of Immortality. A shadow is an object blocking the light. And what these conglomerates are doing, they are blocking the light that needs to shine down in our communities because they know what they done was wrong. They know what they done was wrong. So they want to try to continue to cast a shadow. Now, these shadows that they casted on my family caused my family a life of grief, a life of misfortune. What do you think that if they would have came to my granddad and said, Mr. Lacks, we've discovered that your wife's cells are immortal. They keep multiplying, sir. These cells will help the world. May we use them. May we use them. And I know my granddad would have said, yes, sir. Yes, sir. But what did they do? They took them and hid them. For 25 years, my family never knew a word or anything about the HeLa cell. 25 years. And to answer your question, what was your question? No, I'm just kidding. No, no.
You know all this happened, right? And so then how do we, but I think you said it right. The question is, we know this happened, and they should have asked, and they should have done the right thing, right? And the question is, I don't think that people, I think we have to have more ways that we are actually having more people show up and be not just waiting, for people to ask, but being like, we are here, and does that make sense? Like, yeah. I don't know, I feel like there's like this, like, we want to have more places where people can participate in research. Absolutely. And show up and do that more in a way, and then vice versa, researchers saying, like, learning from that message.
And this is what HeLa House, this is the essence of HeLa House, because we are from the hood. We are from the communities. We're not from, I wasn't born with a silver spoon, neither was Candice David. We are from the hood, and we want to give back. So Henrietta Lacks and her cells are immortal. So we want people to be immortal like her. That was the theme of today, immortal like her. Back home in Baltimore, we've partnered with an organization called Infinite Legacy, which has legs all over the United States, and here it's called Gift of Hope. Is anybody here from Gift of Hope today? In the corner, Gift of Hope, thank you so much. Thank you so much. We want to stress the importance of organ and tissue donation, because that's how you can be immortal like her. To save lives, to help someone else, because she's doing it. She unknowingly done it, but she did it, and she's still doing it. And that's what HeLa House is here for. We want to engage the community. We want people to feel safe, and we want people to trust the process. It happened to my grandmother, and I'm an advocate for medical health, and I'm an advocate for health intelligence. We want people to be intelligent about your own health.
Believe it. You know it's going to have a movie now. It's going to be a movie soon. Listen, we have to quickly, and I know we're hungry, we're all hungry, hear from Miss Hallie. She has some brief comments, and then we're going to bless the food, and we're going to get to it.
All right, good afternoon, everyone. I would like to thank each of you for taking the time out of your busy schedule to join us today for this lovely event. And I first and foremost would like you all to give applause to yourself for taking the time to come and listen and learn about the things that we are thinking about with the Cervical Cancer Awareness Month. And since you all gave a round of applause to yourself, I would also like to give a round of applause to Mrs. Henrietta Lacks for all of the renowned information that she has gave us and the things that she has done in regards to medicine and things of that nature. And secondly, I would like to give a big thanks to Mr. Alfred Lacks Carter for sharing his grandmother with us and being able to help advance the medicine and information that we have today. And just some closing remarks that we would like to make before we go. Just understand, one, the importance of what cervical cancer is. Please remember all of the things that our keynote speaker said, and we appreciate our doctors for being able to come in today. Please give her a round of applause as well again, so thank you so much. Now, you all had great information that we was able to feed within your mind today, so now we want to feed your bodies as well, because that's important also, and we have to be out of here at 4 o'clock, so we just want to express. Okay, so the first thing that I would like to make sure I put everyone's attention to is I'm going to walk around with a post-conversation survey. This survey is extremely important because we want to hear from the community and make sure that we're answering all your questions and get the feedback from you all from the event. Also, any individuals that came on the bus that had the transportation today, can you all please raise your hand? Okay, so we would like you all to eat first because they are on the way here. We thank each of you all for coming, so thank you so much.